Welcome everyone today to our video conferencing call at the Chamber of Commerce here in Sherwood Park. I'm Todd Banks, the Executive Director here at the Sherwood Park and District Chamber of Commerce. Thank you members for joining us here today. I know it's a difficult time and we've been doing this for a long time now, a couple of months, and the stress levels are still there, anxiety is still high. It's challenging times for business and at your business and also at home. So today we're blessed to have Bree Claude here. She's the Director of Family and Community Services at Strathcona County. Before Bree gives her opening remarks, I'd like all participants to know that we have our Slido app for questions you may have that you can access by opening the chat window and click on the Slido link. You can then add questions, and there's also other questions on there that you may be interested in, and you can upvote those, and we will ask those questions in priority of number of votes. So I'm going to read Bree's bio, and then we'll turn it over to Bree here at for her presentation. Bree Claude is the Director of Family and Community Services with Strathcona County. Bree has a degree in political science and a Master of Science in Human Ecology. Bree has been immersed in social policy and practice, strategic planning, and evaluation in a government environment for more than 20 years. She previously held Director and Executive Director positions within the Alberta government in the Ministries of Seniors and Housing, Advanced Education, and Children's Services. Bree's passion is to engage citizens in creating solutions for the challenges we are facing as a community. Ladies and gentlemen, please welcome Bree Claude.
Good morning or good afternoon, everyone. Thank you so much for the invitation today. It's a real honor to connect with the Chamber always, and with members of the Chamber community always. So thank you so much for inviting me, and I look forward to a conversation hopefully today. Title for today, the conversation today is Supporting Mental Health and Building a Resilient Community During COVID-19. So what I was hoping that we could do is really have a conversation, because I think that's where the best stuff happens, is in dialogue. So I'm really hoping that you'll use the chat bar and the Slido app that Todd was orienting us to. So what I was hoping to discuss today is to share a little bit about what we know about the social impacts of emergencies and trauma, as well as social challenges and forecasts that we have around the psychosocial impacts of COVID-19, and why I think Strathcona County is a bit special when it comes to this, and how we can work together to navigate what I've started to call and others have started to call the Corona coaster. And then the last little thing that I'd like us to talk about is how we can make some sweet orange juice. And hopefully that'll make a little more sense in a moment. Todd, if you just want to advance to the next slide. We do have some knowledge and research from traumatic events, disasters, fires, floods, that tells us a little bit about how we can expect to be emotionally impacted by an emergency. And so this is a little bit of a chart that I think what's helpful is to understand what might be coming, so that we can then make choices within that space, or have some awareness of where we might find ourselves on this pathway and this journey. And the other thing is, even though this looks completely time-centered or temporal, it's actually not a perfect example of the emotions and how things happen and what happens first and what happens second. Kind of similar to grief cycles, right? That we expect to experience all of these things. They might not happen in this order, and they might not happen in these ways, but some things to pay attention to. And so essentially what we know is, during an emergency, there's a major impact. There's an awareness that something big has happened. And lots of times what you see, and if you think of 9/11 and some of the bigger events we've seen as generations, there's this heroic moment, there's this honeymoon of, don't let the terrorists win, and we're doing all these amazing things to come together. And usually what happens following that kind of a moment is a phase of disillusionment. And so some reality is sinking in, some loss, lack of choices, the impacts of the actual disaster are starting to really hit us now. And so that disillusionment stage is, kind of the dip that you see after the iceberg is a really tough point. And in the case of a pandemic, we don't know the length of this, right? We don't know how long this disillusionment or how we come back up to maybe better emotional states throughout. So this is just kind of a general guideline to keep in mind. It's not a recipe, it's not perfect. And then eventually, after emergencies, we eventually do come out the other side with some reconstruction and recovery. Next slide, please, Todd. So we're really starting to learn more about a pandemic. So a lot of what we've been trying to gather as far as research has been related to emergencies in general. And as you would know, the pandemic is different because it's not an event that takes place over a couple of days or a couple of weeks and then it's over and we start rebuilding. It's actually, in the case of a biologic disaster that we're finding ourselves in, we don't actually know the timeline, which is one of the really tricky parts about navigating this space. And so we can learn some things from emergencies, but we also know that the pandemic is more than that. And some of those impacts are unforeseen. So we're doing our best medically, socially, economically to make the best decisions, but some of it we don't know. We do know that when we find ourselves in situations like this, that good policy thinking and decisions can be a mitigation strategy. And so we would be looking to the federal and provincial governments around that policy opportunity to help buffer the impacts in all these different dimensions that we're talking about. So pandemics obviously are making us think outside the box, and it's not going to be a linear process. So it's a bit more complex and complicated. So on the next slide, you'll see response to recovery and how it really is complex. And so with natural disasters, it's typically a one-off event, occurs within a limited time frame and a confined location. And in the case of this pandemic, we find ourselves in a global situation. So the other thing that we're preparing for, and we don't know completely how it will go, is the waves of this pandemic, right? So until we have an effective vaccine or we have herd immunity, we know that we could be going through different waves of this event. And that adds complexity as well. And so there's also constant change in how we understand the virus itself, how we understand protection from the virus, and then also how we understand the ripple effects of all of our other policy and legislative decisions around shutdown, and how all of that is impacting us socially, economically, and the ripple of those effects. So all of that to say, it's really complicated and complex. And because of that, there isn't a very obvious, do these things, do this, and we will be okay type of approach in any of our dimensions. And so it's about that noticing what's happening, constantly assessing, and thinking about the ripple effect. I think we've, as a country and as a globe, been really good about how do we contain the virus. And it's also time to put on some other lenses for decision-making around the economy and around social and mental health impact. So next slide, please, Todd. So when we think about the social impacts of COVID-19, what we know is that citizens who were vulnerable prior to the pandemic, so folks who struggled with mental health or addictions or unhealthy relationships, those struggles are going to continue and very likely amplify and become more challenging. We also know that this virus has an uneven impact on older adults and those with compromised immune systems, leading to poorer health outcomes, which also for them, folks who have that additional physical vulnerability can also lead to additional mental health challenges as well, because of the carefulness they're needing to employ in not contacting the virus. So in addition to those who are vulnerable prior to the pandemic, Strathcona County, similar to our country and our province, is likely to see a new cohort of financially and emotionally vulnerable residents. And so this is a group for all of us to pay attention to and be aware of in Strathcona County in particular. And the reason for that is this group of people 2-3 months ago didn't need any additional support outside of their natural supports, and are now going to find themselves, if not now in the coming months, in need of both financial and emotional supports. So some of this kind of statistics and bits of data that we're paying attention to are things like debt levels. So Consumer Debt Index for Canadians, and Myers-Norris Penny released a study in March of 2020 suggesting that 46% of Canadians say that they are $200 or less away from being unable to pay their bills each month. Many are experiencing a lull before this financial impact. And so many citizens right now are qualifying for the Canada Emergency Response Benefit or taking advantage of other deferred mortgage or tax options. And experts are predicting that many will see significant financial impact at the end of August as deferrals and some income supports come to an end. So we're seeing a little bit of a calm on the financial side. On the mental health side, I mean, we find ourselves in a very rare occurrence, and it represents for a lot of us a traumatic event. And so many of us who were socially or emotionally resilient prior to the pandemic, we were doing okay, might now be experiencing high levels of distress. So stress and distress can have significant impacts on our families, our children's development, and then of course dealing with the other traumas. Life doesn't stop because we have a pandemic, so we have the other challenges as well. So because of all these pieces, from a county perspective, social county perspective, we're preparing for both immediate and the longer term impacts, with the assumption that these mental health impacts will be becoming more acute over time. And some experts are predicting the peak of that being about 12 to 18 months from now, based on the impacts that we're having now. So we also have some pretty reliable data related to the impact of financial recessions on suicide attempts or deaths by suicide. And so some of that modeling indicates that for every 1% increase in unemployment, there's a corresponding 0.79% spike in suicides. And they also concur that in most cases, it takes about 12 to 18 months after a financial crash to see the rise in these particular numbers. So as a county, we're really paying attention to, and I'm going to talk in a bit about how we're planning for the current psychosocial impacts of the pandemic, both in the immediate and in the longer term. So on the next slide, all of that to kind of lay the groundwork for mental health is really important. I was reading an article, and I don't believe it was a scientific study. It was the anecdotal observations of some emergency room doctors in California who were saying that in their experience, they were seeing more deaths by suicide than they were seeing deaths by coronavirus. So just a reminder of, mental health sometimes feels like something we can deal with later or separately or if we have time. And I think what's happening through this pandemic is really kind of forcing this topic into the center for all of us. And when I think about the importance of connecting people early to supports, and that's something I'd really like to encourage and emphasize for you, for your staff, for your loved ones, is as you see folks struggling in any way, socially, emotionally, getting help. Research tells us if they get help sooner, they're much more likely to have some better results on the other side. And so if we think of somebody who falls out of a boat and is drowning, we don't wait until their head is completely under the water to throw them the life preserver because they're tired, they're exhausted, they don't have much left. We'd much rather be helping pull them back into the boat when before hypothermia sets in and they're completely exhausted. So just a reminder on, it's not an optional piece for us at this point in where we're finding ourselves in this context. So on the next slide, I make a pretty big declaration that Strathcona County is special in a good way. And so what I mean by that is, sadly, we don't get to sidestep this pandemic. It's happening to us. Sadly, we don't get to sidestep the economic impacts, the social impacts, but we have some really amazing components here in this community that I believe are helping us navigate through this huge challenge in good ways. And the first one I'd like to draw your attention to is something called the Social Framework Leadership Table that the Chamber of Commerce is a member of, an active member of. And this is a group of essentially from school board superintendents to the superintendent of the RCMP, the primary care network, the Chamber of Commerce, from our faith leaders and the CEO of our library, and many, many others are a part of this group. And I'm here to tell you that we have something special in Strathcona County with this table. And we have seen the results of this in spades since the start of this pandemic. This group of people has relationships with each other across all of these sectors. And when conversation is requested, they show up. They come and they lean in and they take collective responsibility for our community and our social and community outcomes. And so that's a pretty amazing thing. I'm going to talk in a moment about a little project that group did on family violence. But as an example, one of the activities, they're action oriented. They don't just want to talk about recovery and say we need to get strategic. They actually do it. And so one of the strategies that they're working on right now is how across all of these organizations and all of these sectors, we can have a shared response to how we prevent violence, how we prevent suicide, and how we lead our teams and our organizations in trauma-informed ways. So healthy, emotional, trauma-informed ways. And so that's a particular piece of work that they're working on now. Also, our business community is amazing. And I don't need to tell this group that. You share that with me all the time. Anytime I've had an encounter with the chamber, I've learned more and I've been blown away by more. And I see it on social media and I see it in the paper right now. And so as businesses are some of the hardest hit in this shutdown and in this strange time we're finding ourselves in, we're also seeing amazing contributions and honestly heroic measures from businesses, whether it's feeding people or completely retooling operations to be able to create hand sanitizer and face shields. Amazing innovation is happening, as well as amazing contribution from the business community here in Strathcona County. And I'd love to hear more about that, by the way. I know you know way more than I do, so I'd love to hear more about that. And then the last bit is that our council is very focused on recovery and very recently passed some bylaws related to 3 council task forces, and they are related to citizen and community, to the economy, and also to governance of this county. So I think we have some elements that are pretty darn special related to that. So on the next slide, I'd like to invite you to work with this community on flattening a new curve, and that curve is around family violence. So we know that we find ourselves in a very critical period right now for violence, for the occurrence of violence. So folks that maybe had a plan or had some propensity towards acting in a violent way, this environment, this lockdown, this stress, distress, financial challenges, these can be the moments where the violence is acted upon and is much more likely to be acted upon. And it's actually called a critical period. And experts in the field, just days before the mass shooting in Nova Scotia, one of the experts I pay attention to, Kevin Cameron, had sent out a blog saying, please be aware, we're finding ourselves in a critical period. For all of these reasons, we need to be particularly vigilant and eyes open to possibility of violence threat. And that is very true when we talk about family violence, and adding to it the amount of time that families are spending together and not connected with all of their natural supports and not having all those natural ways to get rid of energy as well. So one of the invitations I would say to this group and to anyone is to make it your business. So we really need to think about, keep our eyes open for those in our lives, those in our neighborhoods, those in the grocery store, and ideally speak up for and connect to supports for people that we're concerned about. The supports exist. The challenge is getting the people connected to the supports. And so I really encourage all of us to make it our business. So I wanted to share with you one little initiative that took place from the Social Framework Leadership Table. And it was a task force that was struck quite quickly early on in the pandemic between the RCMP, Children's Services, Safe Place, Saffron, and us at Family Community Services. And essentially what it was, we were trying to prepare for, we were watching Spain and Italy, and you're thinking about people being locked in their houses, and knowing that for some people they're locked in homes with perpetrators of violence. And how can we connect with and support folks who are experiencing violence in their lives right now? And so that group worked together to build a community toolkit. And that toolkit is specifically designed for pharmacists and for physicians. And as of last week, the team was able to get out to all, I think it's 28, maybe 28 pharmacies across Strathcona County, and to connect with all of the pharmacists there to share this toolkit. And so the toolkit is very simple, it's very straightforward, helps people identify signs of violence, helps them to understand who to call, when to call, a little bit of a screening to understand if there's something going on here. And that has been shared with all the pharmacists, and I can tell you the pharmacists are saying, thank you. I see this, I worry about this, I've seen this before, and I don't always know in the moment what I am to do about it. And so we've also got the primary care network as a partner, and so all of the physicians across actually Strathcona County and Fort Saskatchewan now have this toolkit and access to this. And we'll be making it available as a community toolkit on our website as well. So could also send that out through Todd to the members as well. And then the last point that I just want to make around all of our role in flattening this curve is communication. And so here's an interesting little fact that I want to share with all of you, is that we had the chance with our emergency social services team to reach out to 252 businesses in Strathcona County in the last couple of weeks. So I'm hoping some of you on the phone would have received a phone call from one of our Terry staff. And really it was to reach out, to ask how folks were doing, to see if you knew about the services that were available due to all of the stress that we're experiencing. And here's what we learned. And I can tell you, we work really hard to tweet and to put it on buses and have articles and all these things. But out of all of these phone calls that we were able to connect with folks, 23% of those who were contacted on the phone knew about family and community services, so the county department that I represent, and what they can do. 18% had no idea that FCS existed or what resources were available. And then 58% were unsure what it was or how those supports might be helpful. So that's a little bit of a wake-up call to the director of FCS, I gotta say, is you think you're communicating, but, and yet we're still not getting that connection happening. So communication, the supports exist. We have a very amazing community as far as supports are concerned, and it's a matter of connecting with them. These negative outcomes can be prevented if we can get the right supports connected to folks. So that's my main point on that one. So if we want to just go to the next slide. And so I threw this slide in there because I just thought, oh my goodness, this just so resonated for me around welcome to the Corona Coaster. So it's a little Urban Dictionary term, recently coined, of course. It's the ups and downs of your mood during the pandemic. At times like these, life is an emotional Corona coaster, and it includes weepy and it includes happy. And I put that in there because I think one of the main points is none of us are coping perfectly with where we find ourselves. None of us. And nobody's going to be resilient and coping all the time. It is a roller coaster of experience, and we can do our very best, and we can try to make good choices, and we can try to be good parents. And actually, Todd, if you want to go to the next slide, I don't know how many of you are in this position, but those of us who are trying to contribute in a work way as well as get our kids educated. And I think you take a moment and take in the, working from home and homeschooling, right? Look at that, peaceful. You got your hot coffee. Coffee's even hot. Everyone's comfortable, child's smiling, everyone's working away. To the actual reality, I feel, of where we're finding ourselves at. So the little chicken, or is he a goose? I don't know. He says, this is so boring, I don't want to do this. And the parent says, I know, but if you just focus, you can be done in like 10 minutes. And then so 2 unfocused hours later of stalling and complaining, and the child's losing it and says, I hate my life. And the parent says, yeah, join the freaking club. So this really is an added stress. It's an added stress for parents around continuing to contribute to their work, and also hoping somehow that their children are learning something. And they don't have the time. They don't have the time, or they have to be out at work, or whatever the case is. And so you can see kind of that picture of stress mounting. So I wanted to throw those slides in there before the next couple, just to say, this is really tough. And it's really tough for everyone. And nobody is sailing through this thing. All we can do is try to do our best and try to make that next choice a better choice, and to take care. And so just the next slide here, Todd, related to supporting youth and families. So there's just a list of things to think about as a parent. And the reason I wanted to do the we're all losing it slide first is these are great ideas when you're able to do them. And our capacity to do them ebbs and flows depending on the day, the hour, and the minute. And so I wanted to share with everyone here about a family resource network. So we have, as of April 1st, we provide a family resource network here at a Family Community Services, and that is supports of all different shapes and sizes for parents. So if your child is 0 to 18, or you know a family who's raising some kids 0 to 18, we have supports for them to get through this time. We have groups, we have education, we have phone support, we have virtual support online, so digital, people who can make their cameras work, we'll do that, as well as when it's best for the family, we can also arrange in-person support too. So awareness of that is really important. The next slide, just basically something I hit on earlier in the conversation about vulnerable populations. And so just to keep in mind that it's actually, although we're all being impacted by coronavirus, some of us are being impacted more acutely and more severely. And so it's important to keep that in mind and to know, where folks who are particularly vulnerable can also receive some support. And that is through calling FCS. So I'll give you the phone number at the end here too. And our next slide is about supporting seniors. So just a little heads up that it is Seniors Week next week, which usually we do some fun stuff, and we have, an event at our Drawson Rec Center, and we all come out and little seedlings are dispersed and seniors have a great time. And we're not doing that this year for obvious reasons. And so we have a virtual way of celebrating, but I think it's just a reminder to all of us. I'm sure each of you on the line has noticed this as well. Certainly it's one thing for us who are in that stage of life of raising children and busy, you still have the busyness and you still have the hugs and the people around you. And then for those who are seniors and a little more isolated and cut off, it has a particularly tough impact. And so just kind of keeping an eye out for our seniors and celebrating them next week. So look for some opportunities. There's going to be a chalk message campaign. So if you have a sidewalk and you have a chunk of chalk, I invite you to write something nice about seniors or how we appreciate our seniors on those sidewalks next week. So the next slide is how can we all lean in? So the assumption here is that all of us can play a role in our healthy recovery as a community. And so, accessing the resources and information, there is a lot online at strathcona.ca if you take a look there. Supporting nonprofits and community volunteerism. So last I talked to Judy, and maybe Todd, you have a more recent update, but over at Volunteer Strathcona, they had, I think, was it 280 or 380 volunteers, kind of that they hadn't known 6 weeks before, who stepped up to help in some way. And so that is such a great way to not only give back and support a neighbor and support the community, but also a way to increase your own resiliency. So when we participate in good ways and healthy ways with our community, it gives us as much as we give somebody else. So community collaboration between organizations, and I talked about that happening through the social framework. Trauma-informed leadership. These are not normal times, and applying a normal lens or normal standard is, our lens is more about how can we get the work done, how can we enable people to do the work in a good way. And just keep in mind that this event is having different effects on everyone, and we can't predict who or when or how or why, but just to be aware that traumatic effect, you can't always predict why that happens or what is triggered for somebody. So the other thing to share is that we are able to offer something called psychological mental health first aid, and that's starting in June. And that's a little 2-hour course. It's going to be available to everyone. You'll see more coming out in announcements, or at least 18% of people will see it. And so really wanted this group to hear about that, because as business owners and business people, you're also supporting staff. And so having a little bit of an understanding of what is a psychological concern and how can I respond to it, which is what this course will support people to do, is a really good way to spend 2 hours and just kind of increase that capacity. We also are proceeding with community connection grants, which usually are used to support block parties. And we've had some amazing kind of cool stories and successes and neighbors meeting neighbors. And this year it will be distributed, but within the Alberta Health Services guidelines. And so coming up with creative ways on how to do that. And then there's a hashtag called SC Social Action. And that's a way to share stories. So from your business or your personal story, please feel free to use that hashtag or check that hashtag out. There's a lot of amazing stuff happening related to how people are showing up. And then this next slide is my orange juice reference. So this is something that, a teaching that I came across some time ago, and for whatever reason, it's meant something to me, and it's really meaning something to me now. And so the story with this is a wise teacher held up an orange and said to the student, you know, what is this? And the student said, well, it's an orange. And he said, and what happens if I squeeze this orange? And the student said, well, juice will come out. And he said, well, what kind of juice comes out? And he said, orange juice. And the teacher said, well, why does orange juice come out when I squeeze the orange? And he said, well, because orange juice is what's on the inside. And so this metaphor is related to what happens to each of us when we get squeezed. And so paying attention to our own kind of internal personal climate that we are hosting and creating and convening. And so it's a little bit, seems like an overstated metaphor, but taking care of yourself right now in these times is the best support you can give to your people, to your loved ones, to your neighbor. And so being aware of, and I had this happen at my dining room table a couple days ago when my son was working on something and fussing around and nothing was getting done. And I'd received a stressful email. I got some, not happy news in an email, and I was feeling stressed about it. And I was getting frustrated with my son about him not doing his homework, which is frustrating. But that I was way overreacting to that because of this other thing. And I was noticing, oh my gosh, this is a way overreaction to the not doing the math problem. But this is just kind of a reminder to all of us that we can pay attention to that internal kind of environment that we're creating, because that's what's coming out of each of us. And so it doesn't mean that we're always making sweet orange juice, but it does mean that we notice what we're contributing. So next slide is just a big fat plug for, please call FCS. If you or anyone you know is having any challenges, don't hesitate to call. We have all sorts of confidential supports. They are free. Everything is free right now. During normal times, our counseling is pay what you can afford, which could also be free if that's all people can afford. And so, yeah, that's kind of, that's the end of the whole tale. And the services continue, digital services continue, and as needed, so will in-person services. So there's a whole buffet of things that can be accessed. So Todd, I think I'll just stop there, and maybe we'll see if anyone wants to chat.
So I'm going to start out just with a quick question, and then I'll get the other questions lined up here. So Family and Community Services supports the residents of Strathcona County and the businesses. Can you give us a couple of ideas of what all those different kinds of things that you support, and how you would go about contacting you or getting in the queue for that support?
Absolutely, Todd, you betcha. So we have quite an array of different programs or services. Maybe I'll just touch on a few of those. I specifically mentioned the Family Resource Network related to parenting and family challenges, or just learning. Doesn't even have to be a challenge, just family life. We also have a group called the Solutions Navigators, and they are basically community social workers. And what they will do is support people with whatever their challenges that's coming in that day for them. And so in this time, we are primarily working remotely. And so folks can call the 464-4044 number and be put through to a navigator, either virtually with a FaceTime kind of a function, Zoom or Teams function, or by phone. And essentially what happens is people identify what do they want to work on today, what would be helpful for them today. Right prior to the pandemic, and even more so now, we're seeing a lot of financial conversations. So I'm worried about this, I'm stressed about my debt, you know, a number of things like that. And so the solutions navigators are very skilled in kind of pulling apart the challenges that are happening and supporting the participant to work on what they want to work on, what would be most useful to them. So they make a little bit of a plan and potentially hook them up to, you know, if it's debt counseling they need, if they need subsidy for recreation passes when we're in normal times, access to bus passes, just as well as like basic small C counseling. They'll also do that with you. We also have trained therapists who provide a little bit more medium C counseling. And so they will work with folks in a strengths-based way on whatever relationship or personal issue is coming up for them. And so we, a couple of years ago, redesigned our services to be walk-in. So we had these wait lists and we saw people for extended periods of time and nobody could get in because it was all blocked up. And so a couple of years ago, we switched to walk-in counseling. And what we found was, well, and the research tells us, when someone decides today's the day I'm going to deal with something, that's when they need to connect. And so we've really designed our services around making sure they're available when people need them and when they're most likely to change. A lot of people will come in for one counseling session or receive one counseling session and they're good. Another third of people might come a couple of times. And then there's another third of people that could benefit from longer term counseling. Our program is not designed as much around the longer term, although you can come back as many times as you like. And then we also do mental health capacity building with the school. So that's a project that happens specifically in school. So a lot of that's happening through Google Classroom and online right now, as well as we have a team that provides home support in the lodges, which has been a very kind of stressful program to deliver. But great. I mean, we've been really, really lucky here with our lodges and seniors care to not be facing any kind of outbreak. So that's been really, really fortunate. And that has to do, I believe, with the professional service that our staff are providing and also Heartland Housing in particular. So I think that's most of our programs. And then of course we do work with the social framework team and table, so more around policy and those kinds of initiatives. But that's kind of the breadth of them. And you can access any one of those things through the main phone line of 464-4044.
So Bree, our first question on Slido is, how would you recommend business owners approach the return to work conversation with reluctant team members suffering from pandemic anxiety or trauma?
Yes, that's the question, isn't it? And I have the same question. I have about 70 staff myself too. And so I asked this question to an expert, which I was lucky enough to be able to do. And this is Kevin Cameron, who has built his whole career around violence prevention and trauma-informed leadership. And his response was, start with the staff. So start with those who are very comfortable. And you can see that. You can see that when you're in a grocery store. You can feel the vibe from the staff person if they're stressed about being there or they've become comfortable and they know there's safety in place. And so his idea was start with those who are comfortable and let them come in and experience how the physical distancing is being handled, how the safety is being handled, and talk about the data. I mean, at this point, we don't have a single case in Strathcona County. We have very, very few in the Edmonton zone. And so it's likely to increase in the fall. That's what our health experts tell us. But right now is actually a very, very safe place to be and to be out, particularly when we're washing our hands and all that kind of educational stuff. So really starting with the folks who are more comfortable and letting them tell the other staff is kind of one of the ways that we talk about. And then also talking to them about the facts. Because the facts are this, it's not sitting in a room in the air, right? It actually comes from somebody else's body. Or it comes from you touching something and then touching your own face. So those are a lot of things that for most of our workplaces, most of them, we can pretty much control. So that's one of the pieces of advice. I hope that's in some way helpful.
The next question is there an online resource for business resources you would recommend?
You know what? That's a great question. And I have the resources that I reviewed in the presentation, but I also have a contact over at Economic Development with the province who's leading this small business relaunch. And what I can do, Todd, is reach out to her and see what kind of specific resources they have for small business, and share that back with you, Todd, if that's okay.
Certainly, that would be wonderful. So the next question is, if you see an employee that seems to be struggling, perhaps with depression or anxiety at work, how do you recommend starting the conversation? You talked about having the conversation with those that you thought would uh, accept it the best first.
Yeah.
How do you start a conversation with others?
Yeah, that's an excellent question. And that is when I talked about the psychological first aid, I think that would be a helpful little background piece, because of course, not everyone's going to be a social worker. We need lots of different skills in the world. And so I think the first thing is recognizing how you're showing up to it. And depending on the day, as someone responsible for other staff, I can sometimes show up in a frustrated way, like I just need this done already. And I also, if I take a moment, take a breath, I also know I show up in compassionate ways. So I think the first thing is to check in how you're approaching the situation, and working from that place of human to human compassion um, and heart for that. And so one of the things we know about trauma is that, you've probably all experienced this, where you see somebody who just seems to really overreact to something else that just happened. You're like, I don't understand why they're falling apart. They didn't even know that person, or we make all of our own assumptions, but we don't know people's backstories. We don't know their childhood stories, and we don't know what maybe has been kind of set off for them with recent events. So we don't know if their marriage is falling apart. We don't know if their child is being diagnosed with a disease. We just don't know. And so, and it might not even be those kind of big monumental things. Maybe it's just like, I don't know, I'm just crying all the time, right? And so I think it's that first thing is showing up with compassion. And these are tough times, and they're tough for everyone. And I'm noticing. And then I think sticking to the fact-based language around, I'm noticing a real change in how you're engaging with the customers, or I'm noticing you seem weepy, or, do you want to talk about it? And that observation, because if it's a change from their norm, they're noticing it too, or they're uncomfortable too, right? And then it's that conversation as an employer around, how can I support you? Like, is there anything we can do at work that would make this easier? Do you need to take off for 5 minutes at the end of every hour and go outside and breathe in some fresh air? Like, what do you need? Like, what kind of plan can we put together? The other thing is encouraging them to call FCS, because absolutely we have trained professionals that can help with building some of those plans. And I mean, after all of these things, guys, at the end of the day, you have a business need, and our employees need to support us with our business needs, right? And so similar to how mental health needs historically, but prior to the pandemic, and I know all of us have dealt with that with staff, it's a real thing. We want to support them to address their mental health needs. And also at some point, we need to focus on performance too. So it's kind of balancing all of those pieces, I think. There's lots of people who have way more HR knowledge than I would, but I really think it's that leading with compassion, describing what you're observing in a very non-judgmental, non-biased kind of language, not, oh, you seem to be falling apart, but, I noticed you seem tearful, that kind of thing. So language that isn't judgmental, and then really seeing if there's anything you can do in that employer-employee relationship to support them to get back to their performance they had before. And sometimes people maybe need to take longer breaks. I think for a lot of folks, this whole childcare thing is one heck of a riddle. And so it's just kind of customized, trying to figure it out together.
Right. So Bree, this is a question that I have. So there's a lot of businesses that have been closed down, and the employees are working from home at this time. The storefront shut down, the office is shut down, but people have been working from their home office to keep the business going.
Right.
The provincial government has asked all businesses, once going back to work, put in a business plan for how you're going to start up, how you're going to make it safe for your employees and safe for your clients or customers. That plan that people make up a lot of times, from the conversations I've had with businesses, comes from a human resources department or from one person making the plan.
Mm-hmm.
But there's varying degrees of um, feelings of your employees or clients of safety. Is there a way that people could do that? You know, I'm thinking maybe there's more collaboration between the employees, something like that. But what would you suggest businesses do to make up that plan so that it's more accepting by the entire team?
Mm. Oh yeah, that's a really good one, and it's something the county is dealing with as well as an employer. And some of the things that the county has done that I think have really helped kind of lower the temperature for people, and we just did it a week or two ago with our supervisor team, was around that OH&S education and clarity of where we're at as far as our best doctors and our best thinkers in this country, and here's what they're recommending. And so I think it's about sharing information, but I think it's also about hearing people out, making documents available. So if it's, here's the plan we're looking at, what's your feedback, giving staff a chance to maybe provide input or feedback. Maybe there's language, they might propose some different language. I mean, at the end of the day, the business need is the business need. And some folks might never be comfortable with that. But I think when we engage, and this is really that trauma-informed leadership that you're getting at, Todd, very much so, is, how do we engage our employees in the thinking and the discussion and the sense of influence on it, right? And lots of times when you do processes like that with teams, the document itself or the direction might not change dramatically, but the process has been more important. So I think it's that collective participation in the creation of something that of course also fits with the guidelines and OH&S and all of the specifics. Like you've got your givens and then you've got ways of implementing it. We can do it over this week, or we can do it over 3 weeks, or that sort of thing. So where can staff have an influence on those plans will really help with their level of ownership. People say buy-in of a plan, right? So that implement organizational stuff. So yeah, that's an awesome question, Todd.
So Bree, we've run out of questions here at the moment. I was wondering maybe if you could give us some closing remarks and some good advice for the businesses and their families here in Strathcona County.
Oh my goodness. So I think my main message, really, there's a couple of main messages, and one is that this is tough for everybody. I think that statement of we're all in this together is completely oversaid and 100% true. That none of us get to sidestep this thing, and that we need to really be kind to ourselves. I think our expectations of how we should be handling this, how we should feel, how we should parent, how we should treat our employees, I think we have to really show first compassion to ourselves, because if we can't be compassionate and take care of ourselves and take a break, if there's any opportunity to take a break, whatever that means, we really need to find those spaces. My assumptions are that the summer will, from a emotional perspective, the summer will be okay. We tend to get really drunk and high on our sunshine in this province. We love our good weather because our winters are so fierce. What I think we need to really prepare ourselves for is, taking as much at great times as we can this summer, emotionally and with families as we're able, as the numbers are down, and know that we're headed into some tougher times, and we need to really look out for ourselves and really look out for each other. It is not a shameful thing to reach out for help. It is a human thing. And please, if you are experiencing any kind of feelings yourself around depression or suicide, or just horrible feelings overall, please reach out, and please do so sooner. Because there are ways to cope and there are ways to get through. And little ideas along the way and little supports along the way can make a dramatic difference on how we get through this. So look out for each other, look out for yourself, and please reach out. Please reach out. That's what we're here for. And we will get through this.
Thank you, Bree. I also wanted to mention that you have a Family and Community Services Advisory Committee, which I'm on with you, and thank you for allowing us to be part of that. But there's over 20 stakeholders in that group, and we've been meeting together probably every other month for the last 2 or 3 years. And I just want to commend you on building up such a great relationship with those key stakeholders within the community, and the great work that we've accomplished through those years. But what you've done as the lead on that is created a base for our community that supports emergencies such as this pandemic. And I believe you put the groundwork in to help all of the Strathcona County residents here in providing services during a pandemic that we may not have been able to approach in the same way if it wasn't for your committee and the collaboration you created for that. So I personally want to thank you for that. And it's such a comfort to know that there's a place in Strathcona County that can provide these very much needed services. And before you go, I'd just like you to talk a little bit about domestic violence and what you've done working with that group, because it's incredible.
Oh, thank you, Todd. And it's very touching words. Very thank you so much for that. It really is special here. I know I'm biased, but Strathcona County really is amazing in the way. I mean, how many Chamber of Commerce leads are going to talk like that about the social issues, Todd? How many superintendents of schools will just, clear their schedule and show up for these collective meetings? How many, I can go on and on with our library partners and our RCMP partners. It is such an amazing group of system leaders here, and they go beyond their own business plan, right? They step out and they say, we care about this whole community. We're going to do it together. So it is such an energizing and amazing place to work. And yeah, on the domestic violence, Todd, from that table, it's been a topic with lots of energy and lots of concern. And we had our own tragedy here a couple of weeks ago that I know all of us, whether you knew this family or did not know this family, are heartbroken by it, and heartbroken that it happened here, and we weren't able to prevent it. And so that group, based on that event and others, is extremely motivated to create conditions that don't lead to that kind of outcome. And so we are working together on a commitment to each other across those sectors and across those organizations on how we are going to work together to prevent violence and prevent suicides. And we're going to start talking about it, for one. Suicide is a topic that affects so many, and we're very quiet about it. It's kind of been one of the bees in my bonnet since I've been in this role. Is you find out about these things we don't have a good way of handling it. We don't have a good way of talking about it, and we need to do better. And so that team, Social Framework Leadership Table, is absolutely taking that on. So that's our work right now and in the coming months. And we hope to have something to share, something practical to share on that in the fall, as well as we talked about the community toolkits as well that are available. And I can also make that available to you too, Todd, around sharing with businesses on how to recognize signs of violence and what we might do to prevent terrible outcomes.
Thank you, Bree. So before we end our conference call here, I would like to thank Bree for all the reasons I just spoke of just before this, but also to make time in her this busy time in her department It's a pleasure to have you here, and you do excellent work, and we appreciate everything you do. And as a last note to our membership, those that are on here, I would like you to do just a quick poll for me, because for ongoing um, meetings, I'd like to know what the best day and time is for you. So I'm going to put a little poll up on the screen here, and I'd ask you to pick as many days that you think are the best days for you, and then click the morning, lunch, or afternoon for the time of them. So I'm just going to put it up here now, and we'll give you 5 or 10 seconds here to click the appropriate boxes, and I'll show you the results. There should be a poll on your screen now. And the results, I think, Thursdays in the afternoons looks like the best time. So we're looking pretty good here. So I'm going to stop the share. And I want to thank everyone, the membership, for participating today. Bree, thank you so much. Very wise and information there for us to go forward with in these difficult times. And I hope everyone does feel welcome to reach out to Bree's department if there's any need. Thank you very much, and have a good afternoon. Take care.